Start whenever you're ready, Daryl.
Very good. Good morning, everyone. Welcome to the Policy and Personnel Committee. Today is Wednesday, December 1st. I just want to recognize the amazing path and strategic planning by the authority to accomplish the paid family medical leave insurance program, which went live this morning, we heard, with applicants already. So congratulations to the authority for the December 1st rollout on the benefits program. Excellent.
Here, here.
Thank you.
Today, I'd like to call to order and have an attendance roll call. So to you, Amber.
Thank you. Eva Bermuda Zimmerman,
Present.
Daryl Duzinski,
Present.
Mike Soltis,
Here.
Paul Potamianos has not yet joined us. We have a quorum. Thank you, Daryl.
Thank you, Amber. For our September 1, 2021 meeting minutes, is there a review or questions, comments? Looking to
Motion to
approve.
approve.
Thank you. Second,
Second.
all in favor?
Aye.
Aye. Against? Okay, it is approved. Review and approval of our November 2nd, 2021 minutes. Any questions on the review?
No.
A motion?
Move to approve the minutes?
Second.
Thank you. All in favor? Aye.
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 Any against? Okay, motion's approved. With Michael up next, a discussion of comments received concerning the consolidated policy.
Good morning, everybody. Happy December 1st. I hope everyone had a happy Thanksgiving. And also, I hope everyone enjoyed Sunday where we got a little brief snow. I feel like winter finally arrived. Good times. So I'm here today to talk about the consolidated policies. As the committee knows, we drafted a large series of policies, about 35 pages, kind of related to a lot of the ways that the program is going to interact with the public at large, from the claim process, the benefit amounts, how contributions work, how penalties operate, and how audits will eventually operate. So we shared that with the public. We just finished the notice and comment period. And not surprisingly, we received a large number of comments and questions. So unfortunately, we probably don't have time during a meeting like this or the eventual board meeting next week to go through all the comments. So what we decided to do is try and highlight the more controversial comments. I don't mean that word to be like provocative, but just the ones that had the most comments about them or questions about them, or which had significant impacts, or items that we felt deserved further conversation in a meeting such as this. So we had about 14 topics, and I will pull that up if I can share my screen. Amber, are you able to open that up?
I am actually not the host here. Aaron, would you mind giving Mike access?
I mean, you could be all set, Mike. Try again.
Okay. Yeah, because I didn't know how to
Perfect.
do it.
Thank you. Can everyone see the Excel sheet on my screen?
Yes, you can see your screen.
Yeah.
Thank you so much. So this is kind of where we captured all of the comments and then our responses. There are the two tabs. The second tab is all the comments and responses. And then this first tab is kind of what I would like to walk through in this meeting. It's gonna feel a little bit like a readout, but I really do appreciate if anyone has any questions, concerns, or wants to raise anything, please don't hesitate to ask. Even though it's only 14 items, I could talk about these for probably 2 hours. So I might talk a little bit fast so we can get through it and not keep everyone here till lunch. But don't hesitate to stop me if I'm going too fast. The first category I'd like to kind of talk about that we got comments on was about the rules around temporary shutdowns. So these could be shutdowns that the employer does due to economic reasons, or holiday shutdowns if a company shuts down from Christmas to New Year's every year. How would that operate in reaction to paid leave benefits? We wrote a policy indicating that during that time, employees are not scheduled to work and therefore would not be eligible for paid leave benefits. We did receive a little bit of feedback with people who weren't happy with that outcome, but we did feel like it was the right one, in part because truly it's not a scheduled work day, so you're not on leave. But then also it mirrors how FMLA, federal FMLA works and the guidance that they provided. So I'm just going to pause for a moment if there's any questions or concerns about that topic. The next several.
I'm sorry, Michael, I did have a question about the response to, not our response to that, but really what the feedback was and how we were reconciling what the person believed was the inconsistent approach with the paid leave laws, explicit coverage for unemployed workers. Because I think it's important for even this meeting, for the benefit of our committee members, to distinguish between what we're defining as unemployment and what just being furloughed for a couple of weeks because your workplace happens to traditionally close on those 2 weeks. Because there's a difference there.
Yeah, that's a good point. And the terminology, I wish the business world use the same terminology at all times, because when we talk about layoffs, sometimes that means a true termination. You're no longer employed. Sometimes that means a temporary layoffs. You're no longer on a payroll, but we're intending to bring you back. Sometimes that people can refer to that as just, I'm not working at this period of time, but I'm still on payroll. So I think it's we wish there was a better way to use the language and capture everything by just saying what a furlough is, what a layoff is.
Well,
And
I'm sorry.
Go ahead.
But one of the things we did do is stop using the words layoff and furlough, because the general meaning of those words is something more permanent than what we're talking about. So we did eliminate those words.
Yes, absolutely. So it's really about, are you employed, which is a defined term in the statute and which we use, essentially meaning, are you still on payroll? And what happens then versus you're no longer employed, your employment has been terminated. And that may mean you're eligible for, unemployment benefits or something else. And you may still be eligible for paid leave, because obviously we have that 12-week rule in our statute. So
I think, Michael, because I was looking at these again, that really, and I don't want to spend a lot of time on this, but the distinction here is whether or not there's an expectation that you will return to that employer. And so even there might be a temporary break in your employment. That's what even though we're not using the word furlough, for these breaks that employers take in manufacturing environments, I think that's what we're really referring to. You're not really unemployed, you're just not working in that particular time period because work isn't available. And that's a different issue with respect to DOL and UI. Because, and I guess I'm struggling a little bit, because sometimes you can be terminated, and because of a separation agreement, you remain on payroll, but there's no expectation that you will return to that employer to continue your employment. And maybe as we think about some legislative changes we might consider, not in this session, but in the future, we might want to think about how we can better clarify that language. You, Aaron, and I can put our heads together on that. So that's it. I will leave it, because I saw a lot of the feedback and I knew that people would not be happy about this. That's why I thought it warranted just a bit more discussion, but we should work on it a bit more.
And we did, just to put a pin in it, we did clarify the policy language to utilize the same language that the federal FMLA does, because they're really talking about the 2 weeks between at the end of the year, or like I don't know if it still even happens anymore, but like the traditional Pratt & Whitney 2-week shutdown every August, like that's what we're talking about here. And so I think by having those examples will help clean up some of those concerns. We're not talking about someone who is laid off, we're really just talking about a true temporary shutdown, the midwinter break, the summer break, that kind of thing.
So this is Mike. I'm sensitive to Michael's comment that you could spend days on these. So just one question. If this law were in effect in 2020 and 2021, when many employers shut down indefinitely due to the pandemic for indefinite periods of time, are we saying that once they shut down, anybody who was receiving benefits, those benefits will at least end until they return?
No, I don't think we are, because to me, those were true layoff situations. And our law does allow for unemployed people to receive benefits. So I think that's a great contrasting example. When the lots of restaurants and entities had to shut down, they shut down for an indeterminate amount of time. They did not know when or if they were going to be able to bring people back. It's a very different circumstance than here's our scheduled, we always close in July, or we always have a 3-week break in March. And during that period of time, no one's scheduled you to work. You knew you weren't scheduled to work. So there's no income replacement appropriate for you at this point in time because you're not getting income. And you knew it whether or not you were sick or caring for someone else.
Okay, thank you.
Yeah, and great conversation. I kind of started with this one because it's one of the more, controversial. So I'm glad we did and had this opportunity to speak about it. A little bit less controversial, I hope, is the topic of the 12-month allowance period. So as everyone knows, you get 12 weeks in a 12-month period for paid leave compensation. And Fmla has a few different ways of calculating that 12-month period. There's 4 options available. And then there's 2 specific ways of calculating it for victims of family violence or military caregiver. So a lot of questions about which one we're using. If the paid leave program could choose to match whatever the employer chooses to use. And I think at the end of the day, we decided that the only way this can work is if the paid leave program picks one way to calculate the 12-month period and uses it across the board for everyone in the program. That could potentially lead to inconsistencies between the FMLA leave if the employer uses a different version and the paid leave program. But we explored seeing if we could mirror employers, but there's no way to do it. Probably the best example is if someone has 2 jobs, they only get one 12-month bucket. How do we have those being calculated 2 different ways if the employers happen to use different methods of calculating it? So we clarified in the policies, we're going to use the 12-month rolling look-back formula for all leave reasons. And if an employer wants to use a different method, they can choose to go with a private plan because those would potentially have that option. Any questions about that? Specifically to family violence and leave as a result of that, just clarifying that even though the statute talks about calendar year, we're going to use the same 12-month rolling back. And then there was one question about whether, because FMLA only gives, the Connecticut family violence statute only gives 12 days for such leave, whether that 12-day cap applies or whether it's the full 12 weeks under the paid leave statute someone could use related to family violence. It basically is re-asking a question I think that the board answered previously, that the 12-day cap related to family violence leave applies to the paid leave program as well. Just kind of reiterating that part. And then simple question about how we were figuring out what someone's schedule was in order to calculate paid leave allowance. We updated policies essentially to say that under the public program, we're basically doing a 12-week look back from the date of the paid leave beginning. So whatever their schedule is over that 12-week period of time, that becomes their standard schedule. And if they're on a reduced or intermittent leave, how much utilization is used for each day off would be based on that schedule. And if for some reason they worked less than 12 weeks, but happen to still qualify for the program, we would just use whatever their schedule is for that period of time they worked. Another topic, and this is another one where I'd love to have this be a conversation rather than a readout, involves minimum fair wage. So as everyone's aware, benefits are tied to the minimum fair wage in Connecticut at the time of the leave. And as everyone's also aware, we're planning on having a couple of bumps up in the minimum fair wage in Connecticut over the next couple of years. So the question of what happens to somebody who's on leave during that change from, say, $13 to $14 an hour, do their benefits get recalculated? We are leaning towards having that benefit be recalculated on the date of that change. So, you know, I don't know what day of the week July 1st is, but let's say it's a Wednesday. If someone's on leave for that entire week, Monday and Tuesday would be paid under one calculation, and then Wednesday, Thursday, Friday would potentially be paid under the higher calculation. There was a lot of feedback about this. It's a little bit different than how the other leave programs work, Massachusetts, Washington, New York. And it's a little bit different than how most kind of the insurance policies work. Any insurance policies that are similar benefits, they look at kind of what happens on the date that you last were at work, like a disability policy. What's the situation on the last day you worked? That's the formula for as long as you're out of work for that disability. So we understood it's a little bit different, but we felt like this was still the way to go for a couple of reasons. One being, when comparing our program's formula to, say, Massachusetts or Washington, ours is based on minimum wage. Theirs is based on state average weekly wage, which is just a average of every single employee in the state essentially and how much they get paid in a week, which isn't necessarily a meaningful calculation for most people in that state. You know, if you ask somebody in Massachusetts what the average weekly wage is for the state of Massachusetts, they would have no idea. Versus Connecticut, the minimum wage is a meaningful thing to people. There's a lot of awareness of it. It's a news item. People are much more likely to know about it. That's one reason why we thought we're going to get a lot of questions about it and people who want it to reflect changes. The second reason is because of the way the program is structured, this would incentivize a lot of people who are going to be on a long leave to ask for the leave to be terminated and then refile it as a new leave. They still qualify because they can, even if they're unemployed, they have 12 weeks after they're unemployed to still file a new claim. They obviously still have the condition or reason for the leave that still exists. And so that would just end up with a series of administrative costs as we're closing down one leave, starting up a new leave, gathering all this paperwork, doing all this work to essentially end up where we already approve the same claim, just to give them the higher dollar amount that people will be incentivized to get. So we felt, all told, it is the better option to adjust that benefit amount mid-leave without requiring any sort of extra work on our part. But there definitely was pushback. There definitely were questions and concerns about this, including from our own administrator, Aflac. So I'd like to take a moment, ask the committee what their thoughts are on this, if they think they made the right call, if they think we should re-examine it.
Thank you, Michael. I'll start. I mean, I hearing this and the justification, it absolutely makes sense to me. The fact that someone could be approved for their program, their application at a potentially lower rate, and then come July 1, which is Friday of 2022, a redetermination at the higher rate. So to avoid canceling or ending one program to go into another, that's an administrative burden. There's an extreme cost to that. and it's very much against customer experience. You know, it's not a positive experience. So having it as policy and being able to implement that technology to pay at the lower rate and then the higher rate is extremely proactive, and I'm encouraged to hear that policy being considered. So I would say it's a plus from me, and I would encourage that to go forward. Thank you.
Thank you, Daryl.
So I agree with everything Daryl said. I think that would be kind of crazy to have people end the leave and restart a new one. But I just have two observations. I presume AFLAC could do this. They're just going to have to rerun every leave, right? Come July 1, 2022, they're going to have to make an adjustment for, I guess, every leave, or pretty close to every leave, right?
Yeah, I mean, I'm trying to think if there's anyone, because the minimum wage plays both into, well, I guess if you had a very low paid amount, maybe some of those leaves wouldn't necessarily see a difference, but yes, a significant number of them.
Yeah, which, as you pointed out, seems kind of odd in the benefits world to rerun every leave and make adjustments in their compensation, number one. The other thing, and this is just an observation, is to the extent somebody has discretion as to when to take leave, for example, caring for somebody with a non-acute condition, they may be incentivized to hold off until the minimum wage goes up to get the higher benefit, right? But I think that's just a fact of life. There's nothing we're going to be able to do to change that, or necessarily want to change that. So I think that's the preferred approach, although it is not the normal approach, as you pointed out.
Yeah, absolutely. Thank you.
I was wondering, and I also do agree, but I was wondering, when it's approved and this is out to the public, the final document, will there be a section to further explain details like this, so that the public isn't confused as to why?
Oh, so like more the reasoning behind it? Oh, go ahead, Aaron.
Yeah, I feel like this question might carry over.
We can, so typically what we've done is the policy document stays as it is when the board votes to adopt it, but where there are things that we think need further explanation, we either do that in FAQs if it's sort of appropriate for that. So we could do an FAQ that's like, what happens when the minimum wage changes? And then we can do it. Or if it's more complicated, we can create either like a job aid sort of explanation or other kind of more detailed language, sort of, so it's on the website, people have it to explain it, but it wouldn't be in the policy itself. It would be kind of in a supporting document. I think
And in the policy itself, at a certain point, will you refer to the FAQs so people know, like, go here when you have curiosity about this document?
We haven't done that, but we could probably build some language. So we have, as one of our projects for the website, is to create on the website itself a policy library so that it's all there in one place. And we could probably use some language there that says, here are our policies. And then also, if you have further questions, check out the FAQs and other sources of information. And in particular with these policies, because we anticipate having to rely on them, we drafted them very similar to regulations, so we wouldn't necessarily mix and match it inside the policy, but we could absolutely do it kind of in that policy library, which I think would be a great resource for people. Thank you for that suggestion.
Yes, thank you. More questions related to minimum wage. Okay. Next topic, not a lot to discuss. Just wanted to point out that we did get a large number of comments or questions related to how other income received during the leave impacts paid leave benefits, whether they could hold off on receiving, on filing paid leave claims because they're getting all or a good enough portion from their employer, so-called stacking of benefits. And so we, addressed those questions, but also, did add significantly more language about how other income from employer provided benefits would work, including when the other income, I'm going to use the terms primary payer and secondary payer if people are aware of how that kind of operates. When those other income is primary payer and therefore doesn't reduce for our benefits versus when it's a secondary payer and it might reduce for benefits they receive for us. So really going through all those scenarios and making sure that we spelled it out in the policies exactly how the calculation, the formula works. And then this next item, workers' compensation, and specific to that benefit. The policies as they currently stand say that any benefits, any compensation received under workers' compensation is potentially, I'll call it an exclusion for paid leave benefits. Even if that workers' compensation is not wage replacement. So if it's for like medical bills or something else, which is, I don't think, it may not match the intent of what the paid leave program overall tends to do, but it is actually what the statute says. So if the statute weren't as kind of black and white about this, we might have found a way to have a policy that only looked at the wage replacement benefits under workers' compensation. But as the statute is currently written, we just didn't think we had the authority to override that. It's possible in the future the legislature can adjust that if that truly doesn't match the intent, but it's the plain meaning essentially indicates that any benefits received under workers' compensation for that period of time is an exclusion for paid leave, the paid leave program. Another hot topic was pregnancy, and specifically the kind of extra 2 weeks that an employee can receive benefits for during the course of the pregnancy. We received a number of comments asking us to define that extra 2 weeks and say it only applies if the serious health condition requiring those 2 weeks is related to, due to, connected to the pregnancy, and not another serious health condition that just happens to happen at the same time that someone is pregnant. We understand that desire to do that, and may even match the intent of what those 2 weeks are for. But at the end of the day, similar to the workers' compensation, the statute says, during that period. It doesn't say connected to the pregnancy. So it's not required. It says it in several places. I think there's maybe 3 or 4 references and they all use the same language. So at no point does that serious health condition requiring the 2 weeks have to be, part of the pregnancy itself. In some ways, it may be the intent was to do exactly that, to avoid the complications, the conversations, the disagreement about whether a serious health condition is related to or not related to a pregnancy. It's possible the legislature just literally said it happened during the period of time you were pregnant. That's all that should matter. We don't want to have individual employers deciding that it was connected to or not connected to. I want to pause for a second if there's any questions about that.
Well, Mike, I had a question. And of course, as everybody knows, this is an issue we've been discussing for close to 2 years, right? What is the meaning of that? And your note on your spreadsheet, and one of those pregnancy entries says this is going to be decided on a case-by-case basis, right? And my question is, so who's going to decide that on a case-by-case basis? And what guidance do we provide to whomever's making that decision?
Yeah, that was an indelicate answer. I should have phrased that better. I meant a case-by-case basis on whether the person actually uses the 2 weeks period of time. Because I think the question was, it's an automatic extra 2 weeks. And what I meant by case-by-case basis is if that employee doesn't spend 2 weeks out during their pregnancy, then it wouldn't apply. If they choose to use it and they have a healthcare provider telling them that they need bed rest for 2 weeks, then it would apply. But of course, that only actually works if the pregnancy happens on the due date. So someone may think they're taking the 2 weeks, but they give birth a little bit early and they only ended up using, a week. So that's what I meant by case, not that the decision is a case-by-case basis. The decision's really, your healthcare provider said you had a serious health condition that we verified, and it happened during a time that you were pregnant.
It'd be interesting to see how this plays out, when we look back after the program's been up and running for a year, how many pregnancy related leaves extended to 14 weeks, and to see if it's really kind of an automatic or not. But thank you, that's helpful.
I just wanted to add in that we are working closely with DOL because we always want to make sure that we're consistent with their interpretation, and they do have the same interpretation, both in terms of the during element, as well as the fact that a serious health condition resulting in incapacitation during pregnancy does include, if you look at the way FMLA regulations historically have defined serious health condition and incapacity, it does include treatment, so those prenatal visits, as well as any other serious health condition that occurs during pregnancy. So I think the fact that we're consistent with DOL hopefully will make this easier for employers. I also want to note that we're not saying that we're going to ask every applicant if they're pregnant, but if a person who has a serious health condition tells us that they're pregnant, then they can basically access these 2 weeks, as opposed to kind of us affirmatively making that a question that we ask at every single claim.
Thank you, Erin. The next topic I wanted to bring up relates to private plans. This is another one that we did receive a lot of feedback, particularly from private plan carriers. A little bit of background: when a private plan is moving from one carrier to another but staying private, we did build a rule into the private plan guidance that we adopted last month, that any claims that are in flight will remain with the initial carrier. The new carrier is not responsible for them unless that initial claim terminates. This policy, it was specific to when the private plan moves to the public plan program, or the public program moves to the private plan, and it's kind of taking the opposite stand. So if anyone's on a leave, they're being paid for it at the moment that a plan transitions. When it's going back and forth between private and public, we actually are asking for that claim to be terminated and kind of refiled under the new program. So it's a little bit inconsistent with what we're doing when it stays private and moves between carriers, but we felt it was really the only way this would work, mostly because, I'll use the example of someone who has 2 jobs, one that's private, one that's public. We're able to isolate those, and we kind of say all of your private employment is handled, or private plan employment is the responsibility of the carrier. Your eligibility, the benefit amounts, your leave allowance, everything is kind of just about that private job, and we'll ignore it for the public program. And they can ignore the public job, your second job that you may have with the public program. But once they kind of are working 2 jobs and they're both under, say, the public program, now it's one bucket of kind of time, one benefit filed, one leave allowance, and we couldn't figure out a way for that to work where they had one leave still active at that time, even though they're working for 2 public plan employers. What happens if they file a second claim and the old claim is still active? So really just from the sense of, we had no way of figuring out how to handle that allocation or paid leave allowance when there are the multiple jobs. In addition, the idea of, even if they don't have 2 jobs, of the history, as they call it, in the leave world. When they transition, we want to make sure that we apply any prior leave usage so that they don't get the full 12-week entitlement as soon as the plan transitions. And in order to do that, we need to kind of get the data from the private plan employer. How much time they use will then deduct it from how much time they have in the future. Well, if they're still on leave, they're still utilizing that time. And we'll have to constantly be told, okay, they used another 3 days this week. And we'll have all of these individual people with individual data that we have very difficult time capturing because we've obviously got 2 million people under the program. We can't track every individual person and how much time they're using. So we just kind of needed to draw the line at a certain point, say, as of the date of this transition, here's how much time they're using. We can now account for that instead of having to constantly be updating each person. I don't know if that was too technical. I don't know if I did a great job explaining that, but I'll just pause and ask if there are any questions about the reasons why we chose to operate this way.
I think that approach makes sense.
Thank you. Look at the time. Real quickly, this one, not a lot of comments, there were a lot of comments, but hopefully it's not too controversial. We initially indicated that private plans were allowed to round at the maximum of 15-minute increments for leave usage. The state program, the public program, is going to go down to the minute, so it'll be pretty much as exact as you can as far as how much time is being utilized for each leave. But we said private plans can use 15 minutes. We did receive a lot of feedback that under FMLA, employers are allowed to do up to an hour. So essentially, if you're on leave for 15 minutes, they can charge you with a full hour of leave usage. So in order to match FMLA, we did agree that we can go up to an hour. Now, obviously, they're going to say if they say you use an hour of leave, the paid program will pay you an hour of leave under the private plan. So there's no takeaway necessarily on that part, but and obviously the employer has to truly use the hour incremented. It's not that you apply it to them or to individual claims. And so they can obviously use a short duration if they want as well, but just making sure that our guidance matched what FMLA did as far as how we round increments. The next couple are about the timing of filing of a leave. The first one is we're requiring 30 days advance notice when a leave is foreseeable to file a claim. So if you know you're going to have surgery in 2 months, let us know at least 30 days prior to your request for paid leave compensation that you're planning on having that you're going to be out. That matches FMLA regulations. So we're trying to keep consistent with that. But we did receive some feedback indicating that if we delayed or penalized someone for not giving that notice when foreseeable, we don't have the same obligations that an employer does, and the reasons for that notice don't really apply in the same way as they do to an employer. So for example, if you know you're going to be out and the employer needs to find a replacement for you or figure out what to do with your work, that 30 days notice is truly helpful to them. And the argument was, from a paid leave perspective, we don't need that 30 days to prepare for anything. And I think it's a reasonable argument. We obviously aren't replacing that person's job. However, there are still good reasons for matching the FMLA 30-day notice. For one, the employee's already gathering all their paperwork. They're already submitting their paperwork to the employer, asking for the leave. Why not submit it to us at the same time? The requirements are essentially the same, so it makes sense to have those happening simultaneously. So from the employer's perspective, there's a benefit to that, rather than waiting, giving your paperwork to your employer, and then 25 days later giving it to us. If there's any sort of issues with it, you don't have to go back to your employer for it. Second, the employer is approving it at that time as well. So when we send them an employer verification form as part of our process, it's fresh in their mind. They'll have all the documentation they need. They'll be ready to approve the claim. So it's consistent from the employer's perspective. And then obviously, from the authority's perspective, as much notice as we can to make sure we're following our process and able to get the money out in time so there's no gap in pay. The earlier we get that paperwork and the earlier we can approve the documentation, the better it is for us. Not to mention, just from our, financial planning, solvency of the fund, we know how much we can expect to pay out at any given time. So while we still felt there were value in requiring 30 days notice, we did add a requirement that in order to kind of penalize a person by denying or delaying payment due to failure to provide that notice, the authority has the burden to show a negative impact on us. So it's not nearly that you didn't provide notice, but your failure to provide notice impacted our ability to administer that claim, adjudicate that claim appropriately, and that's why we might delay payment. And then the second two were related to another rule we had. We initially explored the idea and wrote the policy to say that if your leave was due to caregiving of a family member and that person, and you haven't filed a claim yet, but you've been caring for the person, and that person passes away and you file the claim after the person dies, we explored whether we should not approve those claims at all. In part, the idea was it's hard for us to say whether this person truly has a serious health condition, and we can't do a second opinion or third opinion, for example, because they're no longer here. So we did receive a lot of feedback. They didn't think that was fair. And at the end of the day, we agreed it didn't make sense. It was probably too harsh a rule. And we decided to use the same standard for those claims where the person being cared for has passed away as we use for any other leave, which is essentially you cannot file a claim more than 45 days after the first date of compensation, unless you have good cause to do so. So kind of allowing that to follow the same rules as everything else. All right, next topic, wages and subject earnings. Request to more specifically define what wages count and what wages do not count towards the program. And a couple examples of things where we need to make sure we locked it up pretty well. If someone's working for two employers and they qualify under one employer, but the second employer is exempt. So for example, I'm a school teacher and the Board of Ed, hasn't agreed to participate in the program. That employment's not part of the public program. And if I happen to have a second job, working minimum wage over the summer or over the weekends, I wouldn't be able to use that minimum wage job to get eligibility and then bring in all my teaching earnings kind of in the back door and have that be part of my benefit amount. We didn't think that matched the intent of the law, so that was one example. Or someone who's working out of state and moves to Connecticut and just happens to qualify just enough earnings in Connecticut to qualify for the program. We can't take their out-of-state earnings and have that also apply to the benefit amount. So really, we just wrote the language essentially to say we're only counting earnings that were earned in service to an employer who participates in the paid leave program, as well as specific rules about employers who previously didn't apply or didn't participate but then chose to, sole props, self-employed, and kind of how those rules work. But specifically tying the language so that the benefit amounts are based on earnings you received, sort of related to the program. And that's, in some ways, it's both a positive and a takeaway for employees, because if we went the other way, if we included any other extra earnings, just because the person happens to be eligible under different employment, they now have to owe contributions for those amounts. So if we did that, if we told that school teacher example, both jobs count because you qualified under one job, now you owe 0.5% of your teaching salary. And now that school system has to figure out a way to figure out which teachers qualify and which don't. Nobody wants to go down that route. It's a nightmare. So I think at the end of the day, it's not a takeaway for employees to go to use this route, because it added too much burden to them to begin with. So even though their benefit amount may not be as high, under an alternate reading. It end of the day, it's probably matches the intent of the program. I'm going to pause there for a second. Any questions? Okay. Next topics. A couple of questions about, we have a couple of waiting periods for employers who did not participate but then choose to participate, both in the sense of, the exempt employers like municipalities who a union can, collective bargaining agreement can agree to participate in the program, and in the sense of sole proprietors or self-employed who elect to participate. We put a 3-month period of time in between their registering and when they can then start filing claims for paid leave benefits. And we have had a few questions about why we were doing that, what outcomes can happen as a result of that. I think there are a few reasons why we chose to add that 3-month waiting period. One is administrative. They have to notify us of it. AFLAC has to be aware of it. We need to make sure that if any claims come in, we're ready to approve them, that they are now, participating in the program, that we are aware of that. And particularly when we are asking for advance notice, having some time between when we kind of turn them on and when we start getting claims for them is going to be important. Second, there's a level of risk mitigation involved. I'm thinking in particular for sole proprietors or self-employed. If you're going to have a reason to submit leave, you've been earning a ton of money in your own business, and you plan on shutting down that business as soon as the leave's over. So as an example, you're going to have a baby and you decide you don't want to have this business anymore once the baby's born. Well, you'd have a good incentive to wait until 2 weeks before the due date, enroll in the program, kind of stop earning any income from that program, have your baby, and just collect money from us for that. And never can, you're theoretically, you're required to continue to participate for 3 years, but if your business is shut down, you have no earnings to contribute. You're not getting that contribution amount for that entire period of time. So there is some risk mitigation in requiring, okay, we need 3 months of actual, contributions towards the program. So that waiting period does some of that as well. Any questions? That
To add in here, we also need to recognize, as Michael said, that we don't always get advance notice. And so we can't have someone apply for benefits and potentially be, put in a claim for something that happened before they applied. And then there's questions about who's responsible for coverage. So we needed to make sure we accounted for that.
Thank you, Erin. And then last item is about willful misrepresentation and penalties. So we did receive a little bit of feedback that we were maybe too harsh in what we considered willful misrepresentation with our initial policies. The 2 items that were identified were, we had language indicating that if someone tells us something that they should know to not be true, we consider that to be willful misrepresentation. And there was some feedback that was potentially, may not be intentional. We could just have someone who doesn't understand what's going on. And just because an average person should know it not to be true, maybe that person doesn't. And is that a fair standard to hold them to? And we agreed and thought that made sense. So we kept it at things they actually truly know not to be true. And then the second item was in relation to information they withhold from us. So failure to report information, whether that's considered willful misconduct and willful misrepresentation, and whether they should be penalized for that. We didn't completely remove that, but we softened it and said it's really only applying to questions we ask you or things we ask you to do that you don't answer. Or so if we say, tell us if you received any other income, and you received income and you don't tell us, you haven't lied to us, but you've clearly misrepresented something. So it's only applying to things we asked you to do that you failed to, and not just anything you don't tell us. That was the last item I have. I'd be happy to talk about anything else if anyone went through all the comments and want to discuss them, or if anyone has any questions about things we went over today. Thank you all for your time. And obviously we're planning on sharing with this larger board, hopefully next week, and we can get it approved. And these can become official policies.
Thank you, Michael. Very extensive review. We appreciate it. Next is with Aaron, a discussion regarding the revised employee handbook.
So the good news is, particularly for our time, is that we got no comments on our proposed revised employee handbook. A number of people did ask for copies, so we know people were paying attention, but no one submitted any comments. So we will be asking the board to adopt it next week without revision.
Thank you, Aaron. Next topic is old business. Any old business?
I have a follow-up question on old business. Last month, I think we talked about which of our employees are going to be represented by a union effective January 1. And I wonder if there's any update on that, since we're kind of knocking on the door of January 1. Do we have any additional information on that?
Yes. So we've been working with the HR representatives assigned to us through DAS, and they have been working with the Office of Labor Relations employees to validate our list of who is going to be in collective bargaining groups. I think I mentioned there's basically 3 different unions that are going to be applicable. So our financial folks, except for the director, except for the top 2 people in the financial group, will be in the administrative and residual. The most of the staff who are going to be supporting the benefits will be in the Health and Human Services. Is that P3? I don't remember, Paul. And then most of our IT staff, again, excepting the management, will be in the engineering and technical. So that's P2. Daryl's saying it's not P2. We thought it was.
P2 is human services. I think P4 is the.
Oh, you're right. So claims is P2, IT is P4. So we've got the list. DAS and OPM are kind of validating the list. I really appreciate you bringing this up because I've been asking for a meeting. And so I will again point out that this is an important issue for our board, so I can get this meeting. I want our team to know kind of what this means to them. And so it shouldn't have any day-to-day impact on our folks. In terms of their positions, in terms of their salaries, there should be no impact whatsoever. And our policies kind of have been revised or are going to be revised so that there should be minimal impact on our policies. But I do believe that, they will have the opportunity to meet with their appropriate collective bargaining agents. So that's what we're trying to get set up right now.
Okay, thanks for the update.
Aaron, if you need any help brokering a meeting with the OLR folks, just let me know.
Thank you, Paul.
Aaron, essentially there'll be 3 different groups.
And maybe 4 if we get another clerical person.
Okay.
Yeah.
Thank you, Michael, for the question. Any other questions on old business? Okay. Any new business? Go live today, I suppose. Excellent.
Right.
Motion to adjourn. Thank you, Michael. Second.
Second.
Thank you, Ava. All in favor?
Aye.
Aye.
Any against? Excellent. Happy December 1. Our next meeting is scheduled for January 4th. All the best to the authority. Take care, everyone.
Happy holidays.
Thank you.
Happy CTPL Day.